Hello, and welcome to Chagpar MD. I'm Dr. Anise Chagpar, and today I am joined by a very special guest. Dr. Kathryn Schmitz is Professor of Public Health Sciences at Penn State College of Medicine, and she's here today to talk about the value of exercise, not just in preventing cancer, but all the way through to survivorship. Now, we've talked a lot in this channel about the value of exercise, but I thought that we'd get an expert to tell us more. So what do you say? Let's get started. Welcome, Kathryn. Thank you so much for being here today.
Thank you so much for having me. I'm delighted to have this opportunity to speak on this topic. I care a lot about it.
So, Kathryn, kind of put it into context for us. Why study exercise, and why is it so important?
Well, there's actually history going back to, antiquity with, ancient physicians, Sushrita and Hippocrates, that have all these beautiful quotes about the benefits of exercise for health. We've known about that. Now, when it comes to exercising cancer, that's a much more recent finding. Just in the past 100 years, have we had any sense that exercise might be useful in the setting of prevention, treatment, or survival of cancer?
And so tell us more about that. I mean, recently we all lamented the fact that Justice Ginsberg passed away, and she was well known for her exercise regimen. She was also well known for having 3 different types of cancer. And so put it into context for us in terms of, if we start at the beginning, what are the data with regards to exercise and primary prevention of cancer?
Right. So when we're talking about primary prevention, really we're talking about epidemiologic studies, so large prospective and retrospective cohort studies, largely, that have been done over the past, 40 to even 50 years, that very consistently show somewhere between a 20 to 40% reduction in the likelihood of the onset or incidence of any of the common cancers that we experience in the US and beyond, for those who are adequately physically active compared to those that do not get enough exercise.
And is that related to weight, or is that just purely physical exercise?
Thank you for asking. Actually, there was a really beautiful pooled analysis that was done, led by Steve Moore from the National Cancer Institute, that pulled together data from millions upon millions of individuals from North America and Europe. And they did a very particular analysis in order to adjust for and account for body mass index. And they found that the answer to your question is no, that in fact, for 8 very specific common cancers, that the relationship between being more physically active and reduced risk of onset of those cancers is robust, even after adjusting for the effect of body mass index.
And is there a dose relationship? So for example, is there a certain amount of exercise that you need to do to reduce your risk? And if you can't hit that, don't just bother?
Right. So the great news is that there is indication that even being less sedentary could be helpful. So, a little bit of exercise goes a long way. And in fact, we've known for many decades now in exercise science that the people who benefit the most physiologically with regard to doing exercise are those that go from doing nothing to doing something.
Anything.
Just something. Anything. Get off the couch. Just that much. Get off the couch now.
So for all of our viewers who are sitting down, this is the time to stand up. Yeah. And so it really doesn't matter how much you do, but I think it really is interesting because it does kind of go into that mantra that so many of us have heard about, where people talk about sitting being the new smoking.
Oh yeah. So we actually have evidence to show us that physical inactivity or sedentary behavior is, second only to smoking, and it's catching up on smoking as the leading preventable cause of cancer in the United States. Not because the individual who is sedentary has such an elevated risk of cancer, but because so many people are sedentary. because it is so common for people to be sedentary.
Yeah. And there's no minimum. There's no minimum. Like, even if you're just sitting there and you're thinking, okay, but but just like a 5-minute walk is enough to
Yes.
have some reduction in your cancer risk.
Yes. So actually, one of the things that I talk about a lot are exercise snacks, and we certainly have evidence to tell us that achieving the U.S. Department of Health and Human Services guidelines for the healthy amount of physical activity is helpful for reducing risk of a number of common cancers. We know that, and that certainly is worthwhile approaching. But if your choice is, nope, I'm doing nothing because I can't achieve that, that's the wrong way to think of this. The behavioral scientists will tell us that we instead want to think about behavioral shaping. And so I use exercise snacks, which is to say, okay, right now, while you're listening to and watching this podcast, do 10 squats, just to the chair. 10 squats right now. Let's go. Do it while we're talking. Okay, I can see you doing it. Okay, good, great. So, do that, and then later, find a wall and do some wall push-ups. And what you find is that if you can do these small amounts of physical activity, particularly if they are strength training oriented activity, then they tend to build on themselves. And, these kinds of activities tend to make you feel more confident that you can do more. If you're doing nothing and you start doing just a little bit, most people report an increased sense of energy, an improvement in their mood, an improvement in their motivation for all things in life, and that kind of trips over itself to add more exercise and more exercise.
Yeah, it's kind of a victorious cycle where,
Yes.
you do a little bit and then you feel better and you can do a little bit more, and all of a sudden you're hitting those guidelines. So go over the guidelines for us. What should we be aiming for?
Okay, so there are 2 types of exercise that are included within the guidelines, and these fit for all Americans, older adults, younger adults, adolescents, everybody, those with chronic disease and those who are healthy. So the advice is to do aerobic activity, which is to say the kind of activity that uses large muscle groups and makes you huff and puff a little bit. So you should be breathing harder, but not so hard that you're gasping for breath. That's aerobic activity. Things like walking, jogging, biking, Zumba, swimming, cycling. Those are typical types of aerobic activity. You want to be doing either moderate intensity aerobic activity for 150 to 300 minutes a week, or if you are time pressured, you can squeeze that into 75 to 150 minutes if you focus on vigorous intensity activity, which is more like running, cycling fast, swimming fast. In addition to that, it is recommended that all Americans do twice weekly strength training, 1 exercise per major muscle group. Probably will take you anywhere between 20 and 40 minutes to complete a full training session.
And for that strength training, I mean, are we talking about lifting weights, or are there other things that people can do if they're trying to think about how to incorporate strength training?
Right. So body weight training is certainly a possibility. There's an enormous number of options that are available online. The National Institute of Aging has an entire program for strength training that is a progressive strength training program that I highly commend to your listeners. That's freely available online. There are a number of virtual exercise programs that are available online. And as I said, body weight training is increasingly popular these days. So it doesn't necessarily mean that you have to go out and buy heavy weights in order to be doing strength training.
Yeah. And these days, I think one of the things that we've discovered is that because, as you say, so much of this is online, you can do this without a gym membership in the comfort of your own home. No excuses.
No excuses.
For all of our viewers out there, Kathryn's going to provide me the links to all of those programs, and I'm going to link them for you in the description box below. So truly, truly, no excuses. Kathryn, tell me a little bit more about how we think exercise works. I mean, this concept that you can reduce your cancer risk by 20 to 40% is a
Mhm.
little bit mind-blowing.
Right.
Do we know the kind of the pathophysiology of that risk reduction?
We know some of it. This is an area of active research, and some of it. It really would be divided into two kind of categories. One would be the systemic milieu, which is to say, what's happening hormonally, what's happening with inflammation, what's happening with oxidative stress in the body, and those things are very different in someone who is regularly sedentary than someone who is regularly physically active. Those things bathe the environments where tumors are potentially growing, the tumor microenvironment, and alter that environment in a way that turns on and turns off particular proto-oncogenes or tumor suppressor genes in a way that we believe probably drives a lot of the effects that I'm talking about. In addition to that, those are kind of direct effects. There are some indirect effects as well that we believe occur having to do with the effect of physical activity and regular physical activity on body composition. And obesity, we know, also has an effect on cancer risk. And so in addition to that direct effect, then we believe that there probably is an added effect of obesity and the effect of physical activity on body composition, on fat mass, on muscle mass, on bone health, that indirectly, because of the changes hormonally, as a result of those changes, that then also changes the tumor microenvironment.
Yeah. Now, you had mentioned that obesity is related to, I think, about 8 different cancers. Are
Exercises.
exercises related to about 8 different kinds of cancers? Can we extrapolate to other cancers in general, or is it really only those 8? So if you, for
Right.
example, say, I don't have a family history of breast cancer or colon cancer or lung cancer or whatever cancers are associated with exercise, is that an excuse not to get off the couch?
Nope. Nice try. So, yeah. So largely, what we know is that for the most part, there's cancers for which we do not have epidemiologic evidence. It's because we don't have the size of the studies because they're rare cancers. And when we do find ourselves with sufficient evidence, for the most part, most cancers are related to physical inactivity. And so we believe it's largely through those direct effects on the hormonal and other milieu that bathe the tumor microenvironment.
Yeah, and even if that 20 to 40% risk reduction of most common cancers isn't enough for you, exercise is really good for your heart, it's good for your brain, it's good for your gut, it's good for your lungs, it's good for your circulation.
Mm-hmm.
Like, just do it.
There you
Um,
go.
so the next question is, let's suppose, either you were exercising or you weren't, but many of these cancers, as you say, are so common and you're diagnosed with cancer.
Mm-hmm.
What is the role of exercise once you have a diagnosis? I mean, does it help with treatment? Does it help to prevent recurrence? Tell us a little bit more about the role of exercise during the cancer journey after a diagnosis.
Mm-hmm. So yeah, so this is I'll kind of go through it as succinctly as I can. Well, we really start with a program of prehabilitation, which is to say, even if you have just a few weeks between the point of diagnosis and your first treatment, regardless of whether your first treatment is chemotherapy, radiation, surgery, or something else, there is tremendous value in getting established with a fairly rigorous program of aerobic activity and strength training in order to shift that hormonal milieu that is bathing your tumor microenvironment, in addition to prep your body so that it is better able to recover from whatever treatments you're about to undergo. Once you are going through, I'll just walk through each of the treatments in turn. After surgery, there is really lovely evidence from our colleagues in anesthesiology about early recovery after surgery, ERAS protocols. And we know that just simply getting moving more after your surgery, sooner than you would imagine after your surgery. And I'm not talking about strength training. I'm not talking about even aerobic activity. Walking, just simply getting yourself moving, getting to the point where you're walking 30 minutes a day, and you're able to withstand that for the time period when you're recovering from surgery is really outstanding for clearing the body from all of that, anesthesia, but also keeping you from reducing your muscle mass and losing physical function as you recover from your surgery. During chemotherapy, boy, where do I start? So many times during chemotherapy, people are treated with corticosteroids. That messes up their sleep, makes them more agitated. The chemotherapy drugs themselves have an effect on cognition. We know that 90+% of patients that are undergoing chemotherapy develop cancer-related fatigue as well. Has everything to do with those corticosteroids, the effects on the brain, and the sort of inflammation response that occurs in people as they're going through chemotherapy. The number one treatment for cancer-related fatigue is physical activity. Could be aerobic activity, could be strength training, could be a combination. There is not a drug on the market that is better for cancer-related fatigue than physical activity. This has been documented. You can look at Karen Musian's paper from JAMA Oncology 2017, brilliant work. So that's fatigue. And in addition to that, there are 7 other cancer health-related outcomes that are improved as a result of being more physically active during active treatment, meaning during chemotherapy and radiation and recovery from surgery, including quality of life, physical function, anxiety, depression. Oh goodness, it's like the dwarves, you always forget one, right? Bone health, sleep, certainly, and breast cancer-related lymphedema. There we go. Yeah. I think I may have remembered them all. When you are done with all of those things, then one of the two most common cancers that are diagnosed are breast cancer and prostate cancer. And when you're done with your active treatment, it's very common for these patients to be prescribed hormonal therapies. And we know that these hormonal therapies have horrible effects on bone health and musculoskeletal health, in addition to having very large effects on cognition as well. And so we continue to have benefits from being more physically active while people are undergoing androgen deprivation therapy or aromatase inhibitor therapy.
And so, I mean, it seems like it really helps with so many of the side effects. And I think that this is something that a lot of people may not have been aware of, at least in the past, where people would think, oh my gosh, I just had a big surgery. I had all of these lymph nodes removed from my arm. I don't want any swelling, so I'm just going to rest in bed and not lift anything heavy. And there was a time when people would say, don't lift anything. Right. But we now know that actually lifting weights reduces your risk of lymphedema.
That's correct. That was my work. Thank you. But overall, I would say, I want to sort of share a story, and I think it's analogous here to think about the history of heart disease and exercise when we think about exercise and cancer. And so, back in the 1950s, Dwight Eisenhower, while he was president, had a heart attack. And, his cardiologist, Paul Dudley White, at what is now Walter Reed Hospital, was sharply criticized for getting the president out of bed so quickly, 3 weeks after his heart attack. And that's now laughable, right? Yeah. Because today we get people out of bed same day, next day, very soon, right? So, and there was a time when, early in the days of cardiac rehabilitation, which is now ubiquitous across the United States and standard of care for people who have had cardiac events or cardiac procedures, there were nurses who were afraid that those patients were going to come back in body bags, right? So there was this ethos, there was a culture around heart disease that said, rest, take it easy, don't push yourself. And we still have that culture in cancer. So we now have the evidence base. We have over 1,000 clinical trials that have been completed in the area of exercise oncology. We have 17 major organizations that came together for a major multinational interdisciplinary roundtable to develop guidelines for exercise for people living with and beyond cancer that concluded, all of the things that we've been talking about. The U.S. Department of Health and Human Services is concluding the exact same thing in the federal-wide guidelines. So we have the evidence, and yet we don't have the awareness.
Yeah.
Right? So how do we shift that? How do you shift that? And so that's why I was so excited to hear from you.
Yeah, no, I think it's so important to kind of get the word out. And, we've talked a little bit about the fact that exercise is great for preventing cancer. I mean, that's one of the things that everybody is always asking for. When are you guys going to figure out how we can prevent cancer? Well, we can reduce risk pretty well with something as simple as exercise. You mentioned that exercise is the best therapy for cancer-related fatigue, so certainly helps with side effects. But what are the data in terms of recurrence and survival, oncologic outcomes?
Right.
Does exercise help there too?
Yes. So primarily at this point, the data in this space is, again, observational. So these are prospective cohorts, retrospective cohorts. People, millions of people that have been followed over decades, right? So, the leader in the research in this area is Christine Friedenreich, who is at the Alberta Cancer Board. And she, every couple of years, publishes an update on this remarkable review that she has been doing for decades now. And what she will tell us is that there are 3 common cancers for which we have really stunning evidence to show that there is a substantive double-digit reduction in the likelihood of death from colon, breast, or prostate cancer as a result of being more physically active after the diagnosis, as well as reduced risk of recurrence for those same cancers for people who are more physically active after their diagnosis. The magnitude of that effect varies a bit across the different cancer diagnoses, but is typically in the 20 to 40% range as well, which frankly, I mean, tell me what drug is going to do that for anybody.
Exactly. I mean, and I think that that's really the key point, is that, there is no drug that can reduce your risk to that level. And so, many of us have been advocating for people to write prescriptions for exercise because the fact that it's free or cheap, that it's not toxic, somehow for people, they can sometimes devalue its benefit.
Yeah. So it's said many times that if exercise were a pill, every doctor would be prescribing it, and every patient would be taking it. So one of the issues is that exercise affects so many different body systems that in a medical model, what physicians are used to doing, and I'm not criticizing, I'm simply noticing this. In a medical model, you prescribe a drug for a particular outcome, for a particular indication in a particular kind of patient. And one of the issues with exercise is that it's good for what ails you. It's good for everybody. It is much more of a holistic, public health, wellness-oriented intervention. And so it's a little bit difficult for people to wrap their heads around the magnitude of the effect that you get from being more physically active until you actually do it. People who get into it do find that it becomes a little bit addictive, that there is really such a benefit to it with regard to mood, with regard to cognition, that it is self-perpetuating once you get yourself going.
Yeah, and even for the people who are not regular exercisers, I think that the data, and there are an abundance of data to suggest that you actually have better outcomes for the 3 leading causes of cancer-related death, that you can reduce your risk of mortality, you can reduce your risk of recurrence. This is really, really incredible data that can really help patients. So, Kathryn, for the patients now, I mean, hopefully everybody who's watched this to this point has come on board and understands the data. And of course, we'll link all of the studies in the description box below, that exercise is important. how do you get started? I mean, is this something like people should just do on their own? Should they
Mhm.
find a cancer exercise physiologist? If so,
Mhm.
where? Um,
Mhm.
People may be confused about how and where to start.
Right. Okay. So the easiest way to start is walking, just simply doing more walking. And so I highly commend that because most people, that's low cost. It doesn't matter if you're rural or urban or suburban or rich or poor. Everybody can do more walking for the most part. I think that there are a broad variety of programs available. I'm delighted to tell you that we've started an initiative through the American College of Sports Medicine called Moving Through Cancer, which has a registry, and the registry has thousands of programs on it across the United States, including every location of the Live Strong at the Y program and a number of major national cancer rehabilitation programs as well. One of the things that I want to make sure to say is that it's not a one-size-fits-all situation. There are going to be people who have significant clinical issues that really do require someone with some specialty expertise and clinical training in order to get them going. Somebody who has lymphedema really shouldn't be starting to do a weight training program on their own. They really should be starting with somebody who understands lymphedema and understands the start low, progress slow mindset that I've espoused through my research. So I think that you really need to find the right fit for you. One excellent place to start, if you have no other way to start, is to find an oncology-related physical therapist to do an evaluation. If that is within your wheelhouse, if that's something you can request of your cancer center, if that's something that you can get to, then that person is exceptionally well trained to be able to do an evaluation and help you to find the right program. The right program for a given person may be, I'm all about the, virtual programs in the basement. That's my thing, but other people really thrive on Zumba and other group exercise programs, some of the Les Mills programs, and they would prefer to go to the gym. Difficult now with COVID, but there are ways to do that online as well. And other people really do need the hands-on guidance of a personal trainer. That is also possible. There are major national organizations that are available to do virtual training and do virtual group training. I would commend to your watchers the Fit Steps for Life organization in Texas that does online Zoom classes with a big schedule of classes every week, as well as the Maple Tree Cancer Alliance, which has done in-person and virtual training for cancer patients across the United States.
So we will leave all of the links to all of that in the description box below. I will tell you, as a Zumba addict myself, who also does all of the Les Mills classes, that even though the gyms were closed, you can catch a lot of those classes online, often for free. So really no excuses. All of you now have learned. Thank you so much, Kathryn, from our experts about how important exercise is to reduce your risk of getting cancer, to help you through your cancer journey and make those side effects and symptoms more bearable, and ultimately to reduce your risk of recurrence and your risk of cancer-related death. It's a simple thing, as simple as get off the couch. I'm going to leave you all of the resources in the description box below. Thank you again, Dr. Schmitz, for being here. I hope all of you enjoyed this video. I hope that you will like, share, and subscribe. And again, if there are other topics that you would like us to cover, please let me know. We would be delighted to do that. Until next week, I'm Dr. Anise Chagpar, wishing you all a safe and healthy week.